All right, so we are going to go through what I call the advanced release series for the hips and low back. It's really not advanced. It's kind of a next level progression. If you've done your static back, if you've done your lacrosse ball releases, and you've done some of the other basic static stretching to help get things to relax and resettle, and you still can't quite get, something's just not quite right, these next couple of exercises can maybe that little release that you're looking for, or that your body needs. All right, so I don't want you to think of these as advanced as in this is something to work up to. They're more like specialty tools when you get stuck in a situation that you just the tools you've been using aren't getting you where you need to be. All right, so the first one is we're going to come up onto our backs. We're going to do a pelvic tilt so that we're squeezing those abdominals and that back is flat. And then you're going to take your hands and put them here. Okay? You're going to take one hand and we're going to do an isometric contraction here. And that basically means we're going to work, but nothing is going to move. So this hand is going to hold this leg in place. So you're thinking about pushing this leg straight, but with this hand here, as you try to push, it doesn't move. We're going to be doing the opposite with the other knee, right? Your hand is going to be here. This, you're thinking about bringing that knee to chest, but you're going to be holding it. So it's going to look like this. We hold and we press. So we're pushing and pulling. 1, 2, 3, 4, 5. Then we switch hands. Now we're holding here and here. We push and pull. 1, 2, 3, 4, 5. Now, we're doing that, all right, as we're squeezing abdominals and flattening the back, doing a pelvic tilt. So it's going to be just like this. We can have the head down if we like. We can tuck that chin, abs tight, push. 1, 2, 3, 4, 5. Switch. 1, 2, 3, 4, 5. Switch. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. Good. Then we sit up. Do whatever test. See if that, retest, see if that did what it was supposed to. If not, we're going to move into the second one. And that's where we are going to take our block. We've got our yoga block. We're going 90-90. We're going to squeeze it nice and tight. Feet are together, so we're kind of pinching our feet, pinching our knees. Abs are nice and tight. Arms out to the side here. We're going to slowly squeeze those abs and start going. We're rocking side to side, but we're keeping a nice tight core as we slowly make range of motion as full as we can. So if you're only comfortable going side to side with it, short, that's fine. Keep it nice and tight, rock side to side. But as you get stronger, as your body starts to release, you're going to go deeper and deeper. All right, so keep that head back. All right, keeping those abs tight, squeezing that block. Something may have relaxed, activated, ka-chunk, ka-chunk. Get up, retest. Let's see how that one worked. Then we move into our final one. Here, we can use a hip band. We can put that up above the knees. We can take our stretch band. We can double that up, bring it up and above the knees. Or if you don't have any of those, you can use a good old-fashioned yoga belt or any belt, because basically what we want to do now is do the exact opposite that we just did with the block. So we've got our band in, feet are flat, we're on our back. Now we're pushing into the band or into our hip belt or whatever we're using. We're going to do the same thing. We tighten up those abdominals with that pelvic tilt. We start going. Basically think I'm on the outside edge of my outside foot, I'm on the inside edge. But I'm creating tension, right? I'm not going in and letting the belt collapse. I'm actually pulling opposite with my right leg now is going this way, my left leg is going this way. And it's leading, but this one's kind of resisting, and I go to the side. And then I roll, and I go to the side. And then I roll, and go to the side. Again, working, keeping that tension on the band, and slowly working that range of motion. Until I get to as full of a range of motion as I feel comfortable getting to. All right, so again, those are 3 advanced specialty tools, if you will. I hope you're not in a situation where you have to use them, but if you are, play with them. And the reason I like to retest after doing single ones or doing all 3 is so you can see which one may be helping you the most. And even if it doesn't give you a full release, maybe you go back and do 2 or 3 sets in a row with a little pause or break in between. Or maybe that's what you need to do throughout the day to get unstuck if this is something that seems to be reoccurring and getting stuck in your daily lifestyle. All right?